Hey everyone, Dr. Tam here from Absolute Integrative Physical Medicine, where every single week I want to come with you with information that can help you decrease pain, increase your longevity and function as well. So today I want to share with you about inflammation. Now, why is inflammation so important? Why do you need to know about it? Because it's something that can either help you or in the long run it can kill you. There is two different types of inflammation. There is your acute inflammation and there's also chronic inflammation. So which one's the good one? Which one's the bad one? Acute inflammation is when you get an injury, you bumped your elbow into something and it starts getting red, you start getting some swelling, it starts getting hot. That is acute because it just happened. It's going to last for maybe 2 to 4 days. And it's something that's good for you. It's the body's protective mechanism. So you have macrophages, cells that come in to really heat up the area. It brings more water into the area as well. That's why you have swelling. Then there is the chronic inflammation. Chronic inflammation is the one that in the long run can potentially kill you if you don't pay good attention to it. What is chronic inflammation? Chronic inflammation could be inflammation that goes into your joints, goes into your muscles over time. It can affect your organs as well, your skin, hair, skin, and nails. And it is a lot of the cause of most autonomic nervous system dysfunctions. And almost all diseases is caused by chronic inflammation of some sort. This was actually written in the Guyton Book of Physiology back in 1920s. Now, why do you really need to know about it? The reason is because when it's acute, you have to understand acute inflammation is good for you. Do you need to put ice? The scientist that came out and says rest, ice, compress, elevate, a few years ago came out and says ice may no longer be the best option. It was great for athletes who need to get right back onto the field, but when you have acute inflammation and your body's trying to heal, unless if it's really causing other issues, ice is not going to be your best option. Sometimes keeping motion in that area, stabilizing the area, let it elevate, is going to be your best option overall. So you have to understand, don't go with ice right away. For all of our patients, if you have questions about whether or not you should ice your body in one area or another, make sure you ask us first, right? We do not recommend ice for everyone. Only in very special circumstances do we recommend. Then there is the chronic inflammation. Over time, your body will oxidize, which means that it gets old faster. Your cells get older faster, wrinkles, hair, skin, and nail starts to break down, your joints starts to inflame, and eventually, what leads to arthritis. Arth means joint, itis means the inflammation of. It could be arthritis, tendinitis. It could also be any form of itis that you can think of. Cellulitis, right? Conjunctivitis. They're all due to some form of chronic inflammation. Let's not even mention the gut, colitis, ulcerative colitis. All these itises, a lot of them are due to chronic inflammation. Now, what do? If you have an acute inflammation, what you should do is, of course, rest, compress, ice. You don't want to compress too much because you have to get blood flow into that area. Depending if it was an injury that was right away, is it an open wound, non-open wound? Could you use laser therapy? Could you use a little bit of heat, a little bit of extra motion to that area? Could that help? Now, if it's a chronic inflammation, then that's where you will need to make sure you are doing the right things in terms of what you're putting into your body. Is it heat that you need? Is it going to be a correction of the joint space one way or another, of the spine, of the joint? Are you eating something? Is there nutrition that you can take? So there's some few things I like to go over with you because we specialize in chronic inflammation as well as acute, but most people come to us due to chronic inflammation. That's about 90% of our patients. One of the big things that we have them do is, number one, you have to make sure you're drinking enough water. 95% of people in America are not drinking enough water, hence they're dehydrated. You should be drinking at least half your body weight in ounces of water. Then you have to make sure you're eating all the right nutrients. Antioxidants, don't put all the bad stuff in. Make sure you're putting all the good stuff in. Taking your supplements, multivitamin, vitamin D, vitamin C, glutathione, NAC, those are going to be important as well. Sleep is going to be important as well to lower your inflammation. Going on walks, getting your blood flow going. You know what? Also, talking with friends or family. It's important because your brain can have mental inflammation as well. You can have brain inflammation. Stress can cause a lot of inflammation. That could go from mental to physiological. So until next time, I'm really glad that I was able to share with you the difference between acute versus chronic inflammation. We'll see you guys next time.